Have you ever received pain medication after a surgery, or maybe because of chronic pain? After you took this medication for a few days, did you start to feel like you needed it in order to function? And when you ran out of pills, did you search for ways to get more? Have you noticed your need for the medication start to interfere with your relationships, your career, and other parts of your life? Well, if you have, you may be noticing the signs of an opioid addiction. An opioid addict takes their prescribed medication more often than what is recommended by their physician. This is because they develop a need for the positive emotional response that the drug provides for them. They often run out of their pills before their next refill, so as a result, they end up taking different kinds of opioids to fill a similar high. Their new addiction could also lead them to stealing medications or going to other doctors or hospitals to have access to more medication. Additionally, an addict might notice a strain in their relationships with family and friends because their need for opioids has become stronger than anything else. Have you ever noticed a family member who seems to always be taking medication? And if you've ever questioned them, they may just tell you they're taking medication just in case their pain returns. As you pay closer attention to their behavior, you may have noticed this particular family member has a change in their sleep pattern, or they're just starting to make poor decisions. If you've seen this in someone you love, they may be experiencing an opioid addiction. An addict within your family may be seen as someone who is going to extreme measures to obtain more medication, especially after they have already gone through their prescribed dosage. This person might also take more pills than what seems necessary to maintain pain control. They also might be struggling to maintain a relationship with you or with your other family members. Friends and colleagues may have similar side effects as previously described when it comes to opioid addictions, especially an overpowering need to have their medication. Maybe they are skipping work or social outings, and when you ask them where they are skeptical to admit that they were at the doctor's office again. Addicts often go to many different doctors to get more than one prescription. They also might be failing to have success at work because of excessive sleeping or a change in behavior. There are various options to overcoming this addiction. In some cases, healthcare professionals provide medication to help alleviate withdrawal symptoms, reduce cravings, or even treat overdose. Some medicines can be taken for an extended period of time or tapered off gradually. Others are designed for short-term use or to treat a person who has overdosed. Group therapy is often an important part of treatment for many patients. When seeking out a counselor or group, it is important to find groups led by psychologists, certified addiction specialists, or other professionals who are using evidence-based strategies. Another option are residential inpatient treatment programs. Some inpatient treatments are brief, hospital-based programs that provide a safe place to go through the detoxification process when you or a loved one stops taking opioids. Others are longer and more comprehensive, and they typically provide counseling and other support methods to reduce the risk of relapse. Many people struggling with an opioid addiction often benefit from meeting one-on-one with a psychologist. Psychologists are professionals who have been trained to empower people and teach them how to cope more effectively with life's stressors and mental health issues. There are many trained psychologists who can provide the support necessary to overcome an opioid addiction. They can help with the number of challenges that are common amongst opioid users. If you or someone you love is experiencing these symptoms of an opioid addiction, please know there is hope.